Yes, I think so.
Working fine.
Okay, I've got two observations, if you like. I'm delighted to see a better pathway than sort of 3, 4, 5 visits before you get anywhere sensible. My two comments would be, first of all, that sounds like it's all wonderful for new patients. Is there any chance that this could also be streamlined for people who happen to move house or their students and go away to college and then come back again to start their new job? Because in my experience, when you get referred to a new service and a new part of it, they all go back to square one, and you might just be, oh, I'm having a bit of problem with my contact lenses. No, you've got to have 3 appointments with all the medical people before you can get your contact lenses sorted out. And they don't start... It's like you start all over again, which is a waste of everybody's time and aggro. So that could be streamlined as well. As part of that, they'll go there and say, oh, we haven't had your notes through yet. Well, can't you treat us with a bit of intelligence so that we actually can tell you something about what the problem is and where we've come from, and not fob us off we haven't got your notes yet? The other thing is also, from my experience, not least growing up as a teenager, I think they treat youngsters a bit better these days. It's the waiting experience in the waiting room for all these appointments is another major factor of patient experience. Like, if you've got 4 hours tolerance of your contact lenses, it takes you an hour to get to the hospital. It'll take you an hour to get home afterwards. By the time you've sat 3 hours in the hospital waiting room, what use is your appointment? And you've still got to get home safely. And my other experience, particularly when I was a teenager and trying to do my O-levels and my A-levels and my Oxford entrance exams, they put you in corridors where it's too dark to see a blinking thing. And yes, I will email you about all that.
Yes. No, thank you very much. So valid points. And, I think it's very complex. As you said, the patient experience starts from the time you receive a letter. If it's in small print, then that's not ideal. And this is just a snapshot of a small facet that we're trying to change. But all of those things, I agree, work needs to be done, but it needs to be put together, and hopefully we can address some of those things. And again, with young patients, all our new patients are young, as you said, starting careers, families, jobs, universities, and we should have care records that can be transferred seamlessly across departments, so you're not starting from scratch. But yes, in an ideal world, but I agree that all of that needs work doing. Yeah, but thank you for highlighting that.
Yeah.
Sorry, can I just jump in first?
Yes, certainly.
I've got possession of the mic, so that's quite good. I thought it was a really interesting viewpoint and gets off to a great start. But what are other hospital trusts doing, and how are you spreading this word, and how do you compare with others?
Yeah. So, John, well, I sort of called up a few places and friends around the country to see what they were doing. And obviously the bigger units like Moorfields, Liverpool have got pathways that are working. What I couldn't do is copy and paste those because they had larger resources or staff or personnel. And what we have to do in this day and age is try and make the most of what we've got in terms of resources. And I thought, well, if I can get the house in order, that way I know what the pressures are, where the problems are. Then I can go up to management and say, this is where we are struggling. Several other units are doing better and we could improve. That way we can ask for resources. But if I didn't know where we are, we didn't have a pathway that was streamlined, then I can't go and explain to anyone where the needs are. So there are units that are doing quite well, but there are a hell of a lot of units that are not. So it's been an eye-opener. I think we're trying to get to a place where at least we can spread best practice. And as I said, there's lots of work to be done still, but restrained by the resources we have.
You get text messages through giving you an appointment. This week I got a text message from my GP saying, how do you think the service went? Rate it 1 to 3. Yeah. Could the Keratoconus group create, what we do at college, a Google Doc with all the questions you're interested in, then ask some of the members to fill it in? You'll collect the data and Google will then automatically create graphs for you of all the data. Yeah. Well, I think massive resource from us. Yes. To then go back to you.
Yes, so when I did this in clinic, it wasn't formal. When I asked my 50-odd patients, it was sort of, on a piece of paper. And it certainly can be done. There's a lot of work done on patient questionnaires, on validated questionnaires. Now, what happens is when you just make up 10 questions between 2 or 3 of you, then you get criticized for saying it's not validated, it's not tested. I had a quick chat with Stephanie, who's going to be speaking later on, to see if we can formalize something exactly as you said, and try and roll it out nationally to see we're asking the right questions. Because as I've shown, what I think we need to do is different from what patients think what they need to do. So we need to sit together and think what's important, what are the things that we should be asking or improving on. But certainly, yes, I think that's a fantastic idea. And I think one thing that will happen from this meeting is we'll at least get thinking about this and hopefully coming up with something that we can use to evaluate. And also helpful to see that if we're going to change services, has it made any difference? It's all well me standing here and saying, oh, we've done this. Hand on my heart, I don't know whether it's improved the patient experience. I'm hoping it has. It seems like the right things to do, but we need to revisit.